After your baby is born, there are two different approaches to addressing the immediate postpartum stage. One is called expectant management. So that's when we're just waiting to see when your body starts to release the placenta. We're waiting for your body to control bleeding. And if there is any sign of hemorrhage or sign you need something, then we step in. So that's expectant management. So we're just kind of supporting a normal physiologic rate, like third stage is what it's called after the baby is born, but the placenta is still inside. Active management is when we're actively doing things to try to get the placenta out and to try to help your body control bleeding. So active management usually looks like someone pretty soon after baby's born, like pulling on the cord or doing some cord. It's called cord traction, where they do a little bit of like downward traction on the cord. I have a cord right here I can show you. Like right after baby comes, you also get Pitocin. If you have an IV, you'll get it through the IV. If you don't have an IV, they would give you a shot of Pitocin probably in your leg. Downward traction looks like this. So instead of like pulling, where we push downward, and that is less likely to cause the cord to break. And it can also sometimes encourage a placenta to come out if it's detached, but it's just kind of hanging out, which can happen sometimes. Pitocin is the synthetic form of oxytocin, so it'll help your uterus to contract. So the idea is like after your baby comes out, we can help your uterus to contract by giving you Pitocin to get it to start making those contractions. And when your uterus contracts, if you can imagine this is like the open wound in the uterus, if the uterus clamps down and contracts, it closes on that open wound and it really controls bleeding. If the uterus is kind of floppy or it doesn't have good tone, maybe because it's tired, or if you're stressed, so you're not releasing a lot of oxytocin, or if you have other risk factors for hemorrhage, so maybe you have like low platelets, so you can't clot blood very well, something like that. They would tell you about that though. But in those situations, having Pitocin can help make your uterus do this so that you don't have as much of a risk for hemorrhage. So there aren't really any risks to using Pitocin in the third stage that I know of. Some people think like if you take Pitocin, it's a synthetic hormone, so it'll mess up your hormones. We don't have any research to show that that's true. There was one study that said that was true, but evidence-based birth said that it was such a horribly done study that they're shocked that it passed peer review, and they don't consider that to be evidence-based. So far we don't really know. Like I'm not aware of any risks of routine Pitocin, but I also will say that often it's not necessary because your body has this perfect biological process woven into place to protect you from postpartum hemorrhage. So like after your baby comes out, in many other cultures, what they do is they just put the baby on mom's belly while mom is she'll like lie back flat and baby will just be on her belly. We'll put a blanket over baby so they're warm, and then everyone leaves them alone. And the pressure of the baby on mom's belly gets your uterus to contract. Putting pressure can make your uterus tone. And then it also can help to contract to release the placenta and control bleeding. And the skin to skin is promoting oxytocin, which is also helping your body do this. And then baby often will be like, I'm hungry, and they'll crawl to your breast. They can crawl, they can actually move. It's really amazing. Just like, a cow or a horse or a deer or like any other animal. They're born knowing how to feed. And every once in a while, there's a reason why we need to give babies a little bit of support. But most of the time, we don't need to give them, any support if we're honoring nature's design and following that normal biological process. So when it comes to, there's like Pitocin and like taking the cord or the placenta out of your body. With Pitocin, I would say that it's safe to do expected management. If you don't want Pitocin, you just want to let your body do the thing, that's totally fine. With my first birth, that was fine. I didn't need it. With my second birth, we did expectant management, and I did bleed a little more, and I asked for Pitocin and got some. And so with my third, I was like, well, I bled a lot more with my second, and I just don't want to, it makes recovery harder if you lose more blood. So I was like, I want to just give me the Pitocin, right after my baby's born. So I chose to do active with Pitocin for my third. They probably will do active management in the hospital, so they automatically give you Pitocin. But I just want you to know that you have options. If that's something you don't want, that's okay. And it's also okay if you do want it. The other thing is the delivery of the placenta. And so let's talk about this. Some providers will say, okay, your baby's out, time to pull the placenta out, and they'll start really pulling or doing a lot of traction and just really try to get the placenta out soon. And they have a very limited timeline that they're operating under for some reason around getting the placenta out. So they want it out within 30 minutes. And if it's not out within 30 minutes, it's officially retained to them. And that is, I think, influenced by a lot of different factors. There are policies that sometimes come into play at hospitals where providers or nursing staff are told, like, do everything you can to shorten how long someone's immediate postpartum window is by 10 minutes, because that'll save us money if we can cut 10 minutes in every single room and turn the room over. I have heard stories like that. So I think that profit is part of some of the reasons why there is sort of a rush sometimes. Many midwives will recognize that it takes the placenta sometimes 30 minutes or more. That's normal. And they won't have concern until it's been an hour or, 45 minutes to an hour, because they understand normal physiology and they don't have these like profit-oriented policies that are like really impacting, their care that they give. There is no clear definition for a retained placenta. Many obstetricians follow the rule that it's 30 minutes. That's their rule. And once it's 30 minutes, then it's officially retained. Many midwifery organizations recognize it as an hour. So no one has agreed on exactly what it is. You do know that if the placenta stays in your body for up to half an hour, after that, your risk of hemorrhage does increase. But that doesn't mean we need to start pulling and try to manually remove it after you hit 30 minutes. What it does mean is that we should try to get your placenta out, but we could do that in lots of other ways that don't involve some more risk. Pulling on the placenta can cause it to come out and leave parts inside. And I know many people who have had that happen to them. Manually removing the placenta, where if the placenta is on the uterine wall, we put a whole hand, past your cervix into your uterus and swipe it off. That also significantly increases the risk for a hemorrhage and infection. So it's funny, like we're going to manually remove placentas at 30 minutes to reduce your risk for hemorrhage, but what we're doing is also increasing your risk for hemorrhage. So that doesn't make a lot of sense to me. I will just say, I'll kind of circle back to like what I started talking about, which was like expected versus, active and what it is that you want. But I just want to share this. If your placenta is really retained, what you could do is ask for an epidural if you haven't had an epidural to give you pain relief while they do that, or even have them put you under. It'll take probably an hour start to finish to put you under, but lots of moms just endure this manual removal, sometimes without like consent, and that is obstetric abuse, and you're always entitled to pain relief. So if you feel like this is something that needs to happen and you really don't want to feel it, I would personally choose some kind of pain management, because it doesn't sound very comfortable. So just know that that's an option you can advocate for if needed. But also I want you to know that if someone says it's been 30 minutes, your placenta is officially retained, now we have to do all these big interventions, you could say, well, am I hemorrhaging? Like, am I okay? Is my baby okay? If the answer is yes, you can recognize that, like, well, there are other providers that probably have a different opinion, because Victoria told me, Victoria has seen lots of placentas be born after 30 minutes and everything is okay with skilled providers. So knowing that, let's try some other natural things to get the placenta out first for a little bit. So you could try to pee. When your bladder is full, the bladder and the uterus kind of compete for space. And so that can make it hard for the placenta to come out. So trying to pee is great. Honestly, if you're like latched to your baby and you're in the bed, just pee onto a Chuck's pad or on a towel. If you're at a home birth and you're on your couch, just say like, I need to pee. I'm just going to pee on the towel. And it doesn't matter. It's fine. Like the midwives are already, and the doctor's like taking Chuck's pads full of blood under you and taking them and like throwing them away. They can just take one that has pee on it. It's not a big deal. And it's very good for your health, in that moment, to try to get the placenta out, to just pee if you can. If you can't pee, you could try to sit on the toilet and get upright. Sometimes that helps. You could even get peppermint oil. Have someone, I've done this for women, like I put peppermint oil on my hands and I'll hold it like under their urethra, because the aromas can sometimes help you to pee. Sometimes it feels hard to pee because of the bladder and uterus kind of competing for space. So that's a trick if you need to try to pee. You can also try to thank your body and say like, thank you body, thank you placenta. I like have the baby now and the baby's taken care of and we don't need you anymore. You did your job. It's time for you to go. And relax. So when we give ourselves permission and we relax and release oxytocin, the oxytocin is going to help your placenta to come out. When there is a lot of stress and hectic craziness happening, that even if it's excitement, if we're like, woo, like we're really, really excited, even that excitement can translate into adrenaline in the body or stress hormones in the body sometimes. So trying to keep the environment chill after your baby is born, because we still need all the same hormones to be flowing in our body to be able to support the delivery of the placenta. So you could try kicking everyone out of the room and cuddling up to your partner and doing like some kissing and latch your baby. Latching your baby can help release oxytocin, skin to skin, relax and feel really yummy, ooey gooey good. That can also be helpful. So those are some natural things that you can do. So going back to expected management versus active to get the placenta out, let's talk about expectant first. You could either say, I want expected management for the delivery of my placenta. Do not pull on the cord unless I give you consent. I would say everyone should probably put that in their birth plan. Even if you want active management, I would still say don't pull on the cord without my consent, because otherwise you have your baby and a provider could just start pulling and you don't really understand what's happening or why, or that you have options or whatever, and moms can feel like, oh my God, just really overwhelmed. No one should do anything to your body without your consent. And in hospitals, sometimes things become so routine that they're like, time to do this, and they just will do it. But that is not okay. So I would put in there, don't pull on the cord without my consent, no matter what you're choosing. If you're wanting expectant, where we're waiting, I would specify that. So we're waiting and waiting and waiting, and you have your baby and no one's touching your body, no one's touching the cord. And then all of a sudden with expectant management, what will happen is you'll feel crampy and you'll kind of feel like you want to push. So that's your placenta saying, I'm ready to come out, and your uterus contracting to help get it out. So if you feel crampy and if you feel kind of pushy, you yourself could do a little downward traction on your cord. If you want to deliver your own placenta, someone else, your provider at that point, when there's signs that your body's ready, you could say, I feel a little crampy. Can you check on the placenta? They can do a little downward traction on the placenta and see if it's coming, or the placenta can just expel from your body on its own, which can happen sometimes without anyone pulling on it. But I will say that the placenta, sometimes I've seen this, I've delivered a lot of placentas. They can like detach from the uterine wall and then just sit above the cervix, because the cervix kind of comes back together. So they're sitting right here above your cervix. The placenta is just waiting to come out. And if someone just does a little downward traction, it'll help the placenta to come out. Same if it's just right inside of your vagina. Some providers could like insert one finger into your vagina and feel if they feel the placenta right there inside. But once again, they need to ask your consent first. And sometimes we just need to make it really clear, like, don't touch my body without my consent. Don't put your finger in my body without my consent. Even if the placenta comes out and you're like, hey, I want to wait for a little bit, I'll let you know if I feel kind of crampy, or let's check in 5 minutes. Let's check in 10 minutes, about it. So you're just setting a deadline. And when they come back, then you can have a conversation, say, yeah, you can check it now, but just let me know what you're doing. Don't put your finger in my body without me telling you to, okay? Or without me saying yes. Just like making it known that that's important to you, I think it matters. That is what expected management looks like. And then of course, in that model, if all of a sudden you start bleeding heavily and your uterus is clearly not having a good time, it's not able to contract very well with the placenta inside, in that case, the provider stepping in and trying to get it out would be ideal. And then with active management, what would happen is baby comes out and they, go to your body and you have your baby and the placenta is still inside, and then you have the cord that's hanging out between like you and your baby, right? I have my baby and then I have the cord like this, yay, and there's a cord like still inside. And so at this point, you could have someone with active management give you the Pitocin and then come up and say, hopefully they'll say like, I'm going to do some traction on the cord, or maybe they'll just start doing it. In which case I would say like, hey, don't tell me what you're doing. I want to be involved with the delivery of the placenta or something like that. And then they'll tell you like, I'm pulling on the cord to try to get it out. So they'll just do some pulling, and hopefully, I don't know how every provider practices, but what they should do is check it. And if the cord elongates, then they can keep doing downward traction until the placenta comes out. But no one should ever pull on the cord, no matter what. No one should ever pull on it, because that can cause the cord to break. And that can cause also parts of the placenta to stay inside because they're pulling on it before it's ready. Gentle downward traction is okay, but pulling is not okay. And I do know that there are some OBs that pull and there are some that don't. Because I've had a lot of people tell me that they've had stories where someone pulled on the cord and then the placenta, parts of it stayed inside their body or something like that. So just doing some advocacy in that moment can be helpful. So making it clear on your birth plan what you want. And I would just put in there, don't pull on the cord, don't touch my body or put your finger in my body without my consent, something like that.